The American Academy of Pediatrics recommends exclusively feeding babies breast milk for their first 6 months of life. This advice comes from years of research that Dr. Susan Landers says has proven the benefits of breastfeeding beyond any doubt.
The antibodies that are in the mother's breast milk are transferred through the milk to babies and provide protection throughout the whole time mom's breastfeeding.
And babies aren't the only ones who benefit. Landers is a recently retired neonatologist and says mothers who breastfeed have a lower risk of breast cancer and lose weight more quickly after delivery. But even though breastfeeding is a natural process, it's not an option for every mother.
It is true that about 1% of women do not have adequate mammary tissue. They don't have adequate mammary gland tissue to breastfeed.
Though this condition is biological, Landers says plenty of other factors can affect a mother's ability to breastfeed. One that's maybe not so well known is a history of breast surgery. Many forms of breast surgery remove the nipples during the procedure, but when they're reattached,
all the little nerves that are in the nipple that perceive the baby's sucking and nursing don't work correctly to signal the brain in that feedback loop. So moms who've had their nipple removed in plastic surgery and then put back on, they can almost never breastfeed.
even having a breast reduction without touching the nipple removes part of the mammary gland, which can affect the amount of breast milk a woman can make. But milk production isn't the only hurdle. Dr. Karen Federici is a breastfeeding medicine specialist at Northwestern Medicine Kishwaukee Hospital. She says learning how to breastfeed can be a challenge for both the mother and baby.
Breastfeeding isn't, unfortunately, always easy. There's a learning curve because we have two people who need to learn a new skill. And we feel the most vulnerable in the middle of the night when we're awake and our babies are crying and we're not sure if we're doing it right, if our babies are getting enough to eat.
Federici says babies have to learn how to properly attach, which can be a lesson that leads to a lot of pain for the mother. Even the most experienced moms can have difficulty. In fact, Landers herself had this trouble with her second child.
She had a tongue tie, and I didn't know it. Here I am, a pediatrician, and nursing through sore nipples, and it was so painful. I mean, my nipples were raw and bleeding.
Landers sought help from her pediatrician at the time, a form of support that Federici says is critical in the early stages of motherhood.
Mothers need a lot of support. They're not always prepared because they're exhausted from childbirth and maybe don't get the support they need before they leave the hospital or don't have enough time to learn before they leave the hospital. And then after leaving the hospital, there's not always a safety net there in all communities for mothers to get help. We don't also have enough support for moms who have to go back to work. So even if they get breastfeeding going well in the beginning, then when it comes time to go back to work, they may not have enough time to pump, access to a good enough pump to maintain milk supply, support from their employer, all of those things.
Which leads many women to rely on formula to feed their children. A 2018 CDC report shows that only 1 in 4 babies are exclusively breastfed. So when baby formula became scarce in February due to a major recall and supply chain issues, mothers around the nation started to panic. One response to the shortage told mothers to just start breastfeeding again. But Federici explains why that idea isn't as simple as it sounds.
If you aren't breastfeeding, you can't just start breastfeeding. If you were and stopped, there is a possibility to relactate, but that takes quite a bit of work and you need support for that to find out how to do that from either with a doctor or a lactation consultant. So it's not just that easy to say, well, you should just breastfeed.
And if you're able to start producing milk again, the baby may not be as willing.
It's not as simple as sucking on a pacifier. Sometimes babies forget quickly. So relactating would mean pumping and then trying to get the baby back to the breast. So again, 2 people are involved. And once the baby is no longer breastfeeding, they sometimes have lost that skill.
One option that desperate mothers may be able to turn to are milk banks. Leslie Mondu is the executive director at Northwest Mothers Milk Bank. It's a nonprofit organization that's one of 31 milk banks across the U.S. and Canada.
We provide a safe source of human donor milk if a mother's own milk is not 100% available. And our primary mission is to serve the most fragile and premature infants. primarily hospitalized infants.
And if the bank has extra milk, they offer a direct supply to families in need. Since their mission is to serve the most fragile infants first, Mandu says the bank requires mothers to have a prescription in order to purchase the donated milk. However, since the formula shortage has put so many children at risk, they've lessened some requirements in order to help families in crisis.
Donor milk is not an unlimited resource, so we do have to prioritize and make sure we always are feeding the most vulnerable babies first. But we are trying to do what we can to help get families through this period of time because it is quite stressful. We wish that we had enough milk to be able to feed every baby, but that is very likely not going to be possible. But we want to help where we can because this is kind of unprecedented.
Mandu encourages anyone who'd like to donate breast milk to reach out to your local milk bank. To find the closest one, visit hmbana.org. You can find more information about Dr. Susan Landers, Dr. Karen Federici, and Leslie Mandu on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
We need to think about how can we protect some corner of that metaverse for good, not for some dystopian Ready Player One future, but for health and wellness.
How healthcare is embracing virtual reality.
Then sunbathing this summer may be riskier than you think.
A tan is a sign that the DNA of your skin cells has already been damaged. So there's no such thing as a healthy tan.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You have this wonderful opportunity to lose yourself in a creative analog task and to really focus on something and let the outside world just melt away.
Think coloring is just for kids? Think again. Then,
it's not uncommon to have kids on the beach find cigarette butts in the sand. And in fact, there's been some cases of kids consuming them, many cases actually, and having nicotine toxicity.
The many dangers of dumped cigarettes. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.